So you have a headache, or you get them often, or you know someone who's struggling with this, you are in the right place. So my name is Laura.
And I'm Abby.
And we are both physical therapists. And in this video, we're going to go over some of the different types of headaches, the exercises that you might be able to do to help with them, and to just give you some strategies to help minimize the headaches that you get. So we'll start out with different types of headaches. So there are things that you need to rule out before you can just go ahead and start doing these exercises. Things like you want to make sure it's not blood pressure related, because sometimes when you have high blood pressure, it can cause headaches, and that needs to be addressed before anything. And also just like being medically cleared, making sure there's nothing else more serious going on. Another thing to check and think about before we start doing exercises is really looking at your nutrition. Is your headache because you're dehydrated, or because you haven't had enough food, or things like that? Caffeine can also be something that causes a headache, right? Or some side effect of other drugs. So just keep that in mind going forward and going through this.
Okay, so one of the most common types of headaches that most people think of is a migraine. They're typically associated with symptoms like nausea and vomiting, sensitivity to light, sensitivity to sound. Some people may experience the aura symptoms, which basically just means like you're seeing through a tunnel.
Or it can also be just like something is telling you that it's coming. So people also get these for like seizures, and they'll have like something that they'll be like, oh, it's coming. And so that's similar with migraines as well. Tunnel vision can be one of those things. And then also, a lot of people just think of a severe headache as a migraine, and that's not always the case. Things that so there are other types of headache are tension headaches and cervicogenic headaches, and those are the things that we're going to focus on in here. So you can have a pretty intense one of those headaches, and they can be really annoying and bothersome and whatnot, but it might not be a migraine headache essentially. Also, ruling out a sinus headache too, and actually coming from your sinuses, when a lot of people also think like, oh, it's my sinuses, it might not be, and it might be tension headache or a cervicogenic headache. Another type of headache is a tension headache. So essentially that is where you have tension in your, some of the muscles around your head and things like that can refer and cause headaches. So you have some muscles up here that assist with chewing, that can refer to this area of the head. This can also be if you have any TMJ or jaw pain, sometimes that can irritate some of these muscles around here and cause a tension headache.
Yep. And then our main focus for this video is going to be cervicogenic headaches. So these types of headaches typically come from muscles or joints in the neck that connect to the skull, which are just super tight and typically will cause headache symptoms. So most commonly, we have muscles that can refer up to cause that headache, and these would be upper traps are a huge one,
And they'll just
that go around the head, as well as SCM, which can also radiate up towards the eye. Then you have your scalenes, which run on the front side of the neck, that can go all the way up to the jaw, and then
side of the
front side.
Yeah, that's okay. Sorry. Okay.
They're on the anterior lateral aspect
Yeah.
of the neck. That can refer up and around the eye and the jaw as well. And then lastly, you have your temporalis that can refer in under the base of the eye.
And then you also have your suboccipitals, which are right back at the base of the skull here. And then that can also come up into this area, and that can also come up behind the eyes. So if you get the behind the eye headache, that can potentially be a contributing factor as well. So essentially, to figure out what exactly is going on, we need to look at how you're moving, right? So if you were coming up to us in the clinic, we would take a range of motion screen and just to kind of see how you're moving. While you're just sitting there while we're chatting, we might look at your posture as well. So if you're kind of really stuck in this position and you're not able to move out of it, that might be something that we would look at. Or if you're kind of hunched over here and you can't bring your head back this way, that's also might be contributing. So there's not necessarily a good and bad posture from a sitting standpoint or working. It's really more so the ability to get into or out of different positions. So if you're stuck in that one position and you can't get out of it, that's something that we would probably want to address. Going with like just general range of motion, we'd have you look down as far as you can, so bringing your chin towards your chest, and depending on where you feel, if you feel a lot of tightness through this area, it could potentially be joints. If you feel a lot of tension coming through the sides, it might be muscular, or if you feel it up here, it might be those muscles or joints. So really a couple of different things. And then go ahead and look up towards the ceiling. And so depending on where you feel it, you do need some thoracic motion for this as well. It could potentially be some tightness up in the neck too, depending on what's going on. You can also have dizziness coming from the neck. That's a whole different video too. So if you do have that symptom, your neck can potentially be contributing to that as well. And then we'd have you turn your head to the right as far as you can. And so we're looking at the quality of motion. Where is this motion coming from? Is it more so coming from like the upper neck, which a lot of our rotation does come from there, and how is it moving throughout like the mid back as well? And then we'll go ahead and have Abbie turn to the other side. And so you can kind of see the skin also kind of moves as well. So you're looking at that quality. And if it's stuck a certain spot, then that might be some fascial or joint limitation that we would want to address. And then go ahead and we're going to bring your ear towards your shoulder. So we're looking at here, do you feel it on this side? It might be more stiff. Or if you feel it on this side, it might be more muscle tightness. So if you feel it on this side, it might be more joint. And then go ahead and go to the other side. And then if you feel it on the opposite side, it might be more muscle. Just a general rule of thumb. So that's just a general thing. We would also look at potentially shoulder motion and whatnot, because the shoulders and even the shoulder strength can play a role too. But that's pretty much a general overview. We would also potentially be looking at breathing patterns. If we're kind of coming up here and using our accessory respiratory muscles, we would want to address breathing. Another thing too to consider is symptoms going down the arm. That would be a different type of neck pain. It would require a little bit more assessment, but you can have muscles refer down the arm. You have nerves that go down the arm as well, so that can be contributing to symptoms, but that does require more of a medical assessment. So we're going to start out going through a couple exercises that we might start with in the clinic, or are just basic exercises to get you moving to help with your headache.
A big one that we like to look at is diaphragmatic breathing. Like Laura said, are you pulling in your accessory muscles, or are you using your diaphragm and essentially exhaling and breathing through the belly? So the big thing is we focus on relaxing the shoulders, relaxing the face, and just making sure that you're really expanding the rib cage and your belly to be able to breathe. So usually this can be done laying on your back. So for Laura, I would tell her to really try to have her hands on her stomach and really try to breathe into those hands without lifting up through the shoulders or the neck. So making sure these stay relaxed, expanding through the stomach.
And some people will go taking a deep breath that way, but you really want to relax the shoulder area and really focus on breathing down into your belly. And you want to expand throughout. You want to go forward, you want to go out to the side, and you also want to go back into the ground. So having your hands here, breathing in, expanding into the ground, and then coming out, and then reversing it, letting it come back up. If you're breathing in really deep, yes, you're going to get that rib cage expansion and whatnot, but you don't want that to be the first thing. You want that to be a later thing.
This can also be done in prone, so onto your stomach. So for Laura, to be able to see the back side, okay, being able to expand up and then slowly exhale on out, and making sure that the neck and the head doesn't elevate as well and hunch up. We want to make sure these stay nice and relaxed.
And you also want to make sure you're not just sticking out your belly. So I could just come here and stick out my belly. You want to be breathing into it, and that's causing that expansion. And don't get frustrated if it takes you a couple times. Sometimes it can take 3 to 5 breaths to actually kind of get it. So try a couple times and go from there.
Another exercise that we would do to strengthen up some of these muscles and also stretch out some of these muscles and joints in the back of the neck would be chin tucks. And what you're doing is you're essentially making a double chin. So go ahead and make a double chin there. Notice, so you see some of the wrinkles in the neck here. And you should feel a stretch at the base of the skull, holding for maybe 3 to 5 seconds and then relaxing, making sure you can breathe in this position as well. A lot of people will tend to tighten up the shoulders as well. And so you can see tension coming through here, or even they like lift their head up off the ground. Your head should be staying laying down on the ground, or if you do need a pillow, feel free to use a pillow, but it should be staying rested against the pillow. You should feel kind of wrinkling. You should feel muscles working in the front, a stretch in the back, and that's how you know you're doing it correctly. You can progress this to on your stomach. And so now here, you're going to do that same chin tuck, but then you can also do a little bit of a retraction. So it's like you smell something bad on the ground, and that'll get a little bit more of the mid-back motion there. So you're still feeling a good stretch there, but then you also get these joints moving here, which can contribute to that kind of forward head position. So if you're not able to get out of that position, these joints might be tight as well. And then you can even add a little bit of a rotation to bias one side versus the other. So you can do that one in supine or prone. So I typically only go like about like a 30-degree rotation and maintain that. I typically would, yeah, and then relax there. But I typically honestly add the rotation in supine with the lacrosse ball even. So go ahead and flip over onto your back. So I have 2 tennis balls or lacrosse balls here. You can use one, you can use both. If you're doing it on both sides, just a regular chin tuck and neutral, you can place these at the base of the skull here. So you get a little bit of extra soft tissue release on these muscles. So bring them underneath right below the base of the skull, and I'll have Abbie kind of fix them if they need to be fixed. You can also use a peanut as well for this, but if you don't have a peanut, 2 tennis balls or lacrosse balls can work. You can always throw them in a pillowcase and wrap it up, and that'll also keep them together. So you can do a chin tuck there and get a little bit more of a soft tissue release, or we can take one of those balls out, and you're going to keep it on that one side. You're going to rotate about 30 degrees to that side where the ball is, and then you can do chin tucks from there. So that's going to get the joint a little bit more on that side, and it's going to get that muscle a little bit more on that side to help loosen it up. And then Abbie mentioned your upper trap. That can refer to the side of the head. You can also have your levator. So your upper trap is going to come here. Your levator is going to come more towards your like shoulder blade area. And that can limit your neck motion and also contribute to headaches. So you can also, since we have these balls out, you can also lay on your back or even go up against a wall and kind of place the lacrosse ball on one of these muscles here. And then for your upper trap, you're going to be pulling your head over to the side and think upper trap, look up to get a little bit more of a stretch. And then levator is the opposite, where you can look down. So if you notice a difference in where you feel it, so here's just going to be a general stretch. Looking up, you're going to feel it more kind of just general on the side, and then down you're going to feel it slightly back farther through this area. And that's kind of how you can bias those. If you want, if you're sitting in a chair or something like that, go ahead and grab the bottom of that chair to keep this shoulder down, because a lot of people will just lean over to the side and then you're not really getting a stretch to that muscle. So here, and then coming across, upper or levator looking down, upper trap looking up.
So a lot of times these can be tight. For instance, you may work at a desk all day and just be in a slumped forward position and having to work on the computer for a long period of time. Another big one is stress. I know, for instance, for me, I'm currently in residency and my upper traps, I feel like, are like this 24/7. So that's a huge thing, is just stress, breathing incorrectly all day long, like we talked about, and just breathing from your accessory muscles. There's a million different things that can cause even poor nutrition and just being dehydrated and causing that forwarding of the shoulders.
And then also you have to look at your rotator cuff as well. This is a muscle that compensates a lot for the rotator cuff. Some of those muscles are weak. So if you notice you get headaches after like an upper body day, you might want to check your form and check your programming, because there might be something there that you can address, and it might be weakness in the shoulder contributing to your headaches as well. So looking at your first rib is a lot higher than you would think. So it's actually like if you feel your collarbone and then you go back a little bit and push down, that's your first rib right there. Your scalenes attach to this and go to the side of the neck here, and attached to like your vertebrae. like I mentioned before, they're involved in breathing, but they also can get tight, and that first rib can be limited and limit rotation of the neck. So how we would assess this in the clinic is I would have you lay on your back, and I would rotate the head as far as they can go to one side, and then I would come up that way, seeing how that is there, and then I would compare to the other side. And if it feels like Abbie might be a little bit tight, actually, on the left side here, where it kind of stopped a little bit before the other side. So I could move it here in the clinic, or if you're at home and you don't have someone that knows how to do that, you can grab a strap and we'll put it around that side, and you're gonna wear it like a sash or a purse, and you're gonna grab it both, on it. Abbie likes to sit on it, which is smart. So she's sitting on it right now. So go ahead and actually turn around so you can see it. So Abbie likes to sit on it there, and then it's going right over the neck or the shoulder there. Or you can hold it like a sash, like I was mentioning before. So you're gonna pull down gently on the strap using your other hand, and then you're gonna lean your head over to the other side, keeping your nose facing forward, and you should feel a good stretch right in the side of the neck there. Doing that 10, 20 times, holding like 5 to 10 seconds, and then you can kind of see how that feels as you go. And this also, so this stretches out the scalenes. This is also a self-first rib mobilization.
Another thing that we can do for helping with rotation as well as extension are things that we call SNAGs. So these are self-mobilizations that can either be done with a towel or a strap as well. But it can help work the joints along the neck to help loosen them up, as well as some of the accessory muscles, and getting them to move in a more comfortable pattern and increasing that range of motion to help decrease some of the headache symptoms. So for rotation, I'm going to put this around Laura's neck. Okay. The big thing here is to have your hands crossed. Good. And since her left hand is on top, we will do left rotation first. So it's going to come right up along that zygomatic arch, so that like cheekbone, and you're not along the jaw, right above the eye, okay? And you're going to gently pull, okay? Hold for like a second or two. You should feel a good stretch along that upper trap, the scalene and levator. And we'll do this about 10 to 15 times on each side, okay? And that's going to help with rotation, and then we would reassess to see if our rotation is better after that. Another different way that we could do this, like Laura did. Yep.
So you want to make sure you're not choking yourself. So this one should stay down. A lot of times people get, like this one can get a little bit confusing, and a lot of people do get confused and start choking themselves, and that's not what we want here. So if you feel like you're choking yourself, take a step back and look at your setup again. So I like to say, put it around your neck, let go, cross your hands, and then grab. So the hand that's on top, the one that is going to go across your cheek. The one that's down is staying down on that side. So you don't want to cross it over to the same side that you're holding on. You're keeping it crossed. And then you're pulling it across your cheekbone, not your jaw, because especially if you have jaw discomfort, you don't want to crank on it, right? So you want to go above the jaw there and pull. And a lot of people will also kind of side bend at the same time. Honestly, you can go a pure rotation, or you can add a little bit, depending on where you feel that stretch the most. And it shouldn't be painful at all, and you can kind of bias it slightly to different like segments too. So if you come behind here, I'm gonna have this low at first, and then I'm pulling it up high. So it's coming down here, versus if I bring this one up a little bit, you can bias slightly a different spot. So that's where, just get a general one first, get comfortable with that, and then you can kind of play around with being a little bit more specific with it.
Another direction that you can do with SNAGs is extension. So this is going to help with that upward motion, okay? So I like to start in the middle of that neck, okay? And basically what you're going to do is you're going to be pulling down first, and then almost like you're trying to draw a J upward to help assist with that extension motion.
And you don't want to crank on it, it's just to put tension on.
So it's just assisting with that motion. And like Laura did with the rotational movement, We can also bias different segments, so you can drop lower and get right above that thoracic spine. You can also come to the very base of the head. Yep. And then still drawing that J motion to assist with pulling that head into extension.
So notice as I come down here, it's more of a smaller J motion here because I'm trying to isolate that extension. And then as you go up, you're gonna get more extension through the neck. So here I'm going up a little bit higher, and then here I'm going even higher. So just do keep that in mind. Depending on where it is on the neck, you're gonna have a different arc of motion.
Again, do these about 10 to 15 times and then recheck your extension afterwards.
And then another thing to consider is your mid-back and shoulder motion. So again, getting out of this position here, you want to be able to open up the chest so your pecs can be tight, your mid-back can be tight, and a lot of times you can loosen up the mid-back into rotation. So one of my favorite exercises is the open book, and there's a ton of different ways that you can do this one. So you're going to be laying on your side, and then your bottom leg is going to be straight, your top leg is going to be bent, your knee is going to be resting on the ground, and then your arms are going to be out in front of you. If you do have neck pain or a headache, you might want a pillow there just to kind of help support the neck. And then you're going to hold your arms out in front of you. You're going to take your top arm and you're going to twist through the mid-back as you come and open up the chest. So you should feel a good stretch in the front of the shoulder, the mid-back, and you want to look at your hand to get a little bit more motion through that neck. If it is uncomfortable with any of these, you can modify the range of motion as you need, so don't go quite as far, or you can even with this one, think about more of a bow and arrow, and that might be a little bit more comfortable as well. So that is one of my go-tos there. If you want to add a little bit more strengthening, you can also add a band. So I would have Abbie hold on to a band and then pull back as she twists, and now we're strengthening into that end range as we loosen it up, because you always want to balance mobility and strength. Make sure as you do that, you're not pulling it up towards your ear, because that kicks on that upper trap. You should really be using your rhomboids, which are more back in here in the mid-back, pinching that shoulder blade down and back. So another thing, like I mentioned, balancing the strengthening with the mobility, you want to make sure your muscles in the back between your shoulder blades are strong enough to get you out of this position. So adding some scapular stabilizers, so muscles that attach to the scapula, like your lower trap here, your middle trap, your rhomboids, your serratus even, which is on the other side of your shoulder blade, that does this kind of motion. Those are good ones to strengthen. And then also strengthening your rotator cuff, like I mentioned before. If you notice the headaches come on after like an upper body day or something like that, you might need to add some rotator cuff strengthening for those smaller muscles to just help keep your shoulders a little bit more balanced and relax this muscle up here to reduce the compensation essentially that you're getting through the upper trap levator area.
So with posture, a lot of times we notice that we're constantly like in a slumped position. With how everything is going today, a lot of people are more on the computers, having to do a lot of like IT, even just like social media, and being slumped forward, which is not necessarily incorrect, but we want to make sure that we can get out of that posture and out of that position comfortably and be able to realign and maintain another posture and be able to come out of it. So a big thing is like, if you notice that you're slumped, you've been slumped for a while, trying to recheck, get into a more erect, upright posture, or if you notice that you need to go to the bathroom, grab something off the printer, go ahead, do a couple exercises, do a stretch, just kind of refocus on that posture before you go back to the computer and slumping back.
It could be as simple as just like squeezing your shoulder blades together 10 times. It could be like a quick upper trap stretch there. It could be a ton of different things that you can do. Even just like leaning back into, if you roll up your like roll up your jacket or something like that in the mid-back, like when you sit back down, just go ahead and like lean back over it maybe 10 times, and then you can get right back to work. So it doesn't have to interrupt your day a whole lot. It's just more remembering to do it. And then like if you do have the ability to work from home, maybe potentially switching up where you're working. So if you have to like sit down for a period of time at your computer, maybe then you can bring your computer over to your couch or like a different chair, or lay on your stomach for a period of time, or stand up at your counter for a period of time. Just switch things up every now and then throughout the day can be really good to make sure you're not getting stuck in one position. But if you are interested in more mobility exercises that focus on areas that are commonly tight with sitting, I do have an anti-sitting mobility program which works not only the upper back, neck area, but also the hips and everything that goes along with sitting. And then if you do want more specific shoulder strengthening, if you are thinking and that is contributing to your headaches, go ahead and check out my shoulder prehab program because those are great options for you. If you're still looking for other things, kind of just learning a little bit more about movement, I do have a video going over squatting mechanics and common mistakes that beginners make when they're squatting. Alright, go ahead and flip over towards me. Okay. Deep breath in. And I can turn my head now. Go see a PT. There we go. And then do exercises after that.